All right, wonderful. Again, this presentation portion will be recorded. I'm going to be turning it over to our clinical faculty here for tonight's session.
Alrighty, thank you, Justin. So I'll start off by introducing myself just because I know most of you probably don't know me. My name is Dr. Gamal Ildin. I'm a clinical assistant professor of pharmacy practice here at FDU. I started about a month ago, and I'm an ambulatory care pharmacist, and my practice site is Ocean Medical Center down in Brick, New Jersey. So it's good to meet you all, and we have with us as well other clinical faculty, Dr. Campbell, Dr. Rahman, and Dr. Niels. So thank you guys for joining us. I know it's a bit late, but hopefully this CV workshop session is beneficial to you all. So we'll start off before we, break up into our small breakout sessions and do some one-on-one CV reviews and Q&As. We want to do like a short presentation in the beginning just to explain to you what a CV is, what it usually consists of, and how to format one, just to get started on it. So the objectives for the presentation are to explain the purpose and function of a curriculum vitae, discuss the difference between a curriculum vitae and a resume, recognize and employ suitable content and formatting for creating a well-structured professional curriculum vitae. So the actual term curriculum vitae is actually a Latin phrase that translates to literally mean course of life. In modern days, however, curriculum vitae refers to a comprehensive and detailed document that provides us with an overview of one's individual professional background as well as educational background, and it's often abbreviated as CV. It's also sometimes referred to as a living document, because a CV is a document that should be periodically updated as you continue to progress throughout your career and you achieve certain professional milestones or accomplishments. You want to make sure that you're periodically updating that CV. So I know sometimes we may be confused regarding what's the difference between a CV and a resume. I know I had the same question as a pharmacy student as well. So I thought it would be good to just discuss some of the key differences between a resume and a CV. So one major difference between those two is the length. CVs are typically much longer and more comprehensive than a resume. They can extend to multiple pages. Some individuals may have 10 pages or longer worth of CV. Resumes, on the other hand, are usually much more concise, and they're generally more limited to 1 or 2 pages maximum. In terms of their content and customization, CV, as we said, tends to be much more comprehensive, a comprehensive record of your academic as well as all your professional accomplishments. And they really tend to be less tailored or customized to a specific job, and they remain relatively constant regardless of the job that you're applying for, because their aim is to kind of present one's full qualifications and all of their academic and professional achievements. Resumes, on the other hand, tend to be more of a summary of one's work experience and skills, but they're much more customized and tailored to fit a specific job that they're applying for. So it aims to highlight specific skills and experiences specific to that job description. And for that reason, resumes tend to be shorter in length than the CV. Alrighty, so what is usually included within a CV? Some main sections that are commonly found within a CV include your contact information. So contact information should always be present in the very beginning of a CV at the top. And we're going to go into each of these categories more in depth after. But generally, contact information, one's education and their training, professional experience, and by professional experience, I mean here more so like your work experience, experiential education, so your APPEs, your IPPEs, any high-level presentations you gave throughout pharmacy school, and a lot of this is going to come from your IPPEs and APPEs as well. any posters or publications that you helped out with and partook in, as well as any professional associations. So if you were a member of any professional organization throughout pharmacy school, such as APHA, BROCI, for example, these you want to make sure you include in your CV, the professional associations you're part of. Any leadership experience you had, so for example, if you were president of APHA, you want to include that. It's a good thing to highlight in your CV. Any professional and community service events you partook in, honors and awards, special skills or expertise that can be beneficial to the pharmacy profession outside of your education, as well as references. So jumping into the first category, contact information. So in the contact information section, which again goes at the very top of one's CV, as you can see here, for example, in this format, you want to include your full legal name, your mailing address, as well as your phone number, and your email address. An important thing to keep in mind is the email address you include on your CV, you want to make sure it's professional. So nothing like, I don't know, cutiepie@gmail.com. You want to make sure it's the professional email that you're including within your CV. Next, we have our education section of the CV. So within the education section, you want to make sure you're including name of the institution, so where you went, for example, to pharmacy school, Fairleigh Dickinson University, the city and state that your institution is located in, the degree you received, month and year earned, so your month and year that you graduated in, you earned that degree. Optionally, you can also include your GPA in that section. It's recommended to include it if your GPA is 3.0 or higher, so you can optionally decide to include that, as well as any academic honors. So for example, if you graduated summa cum laude, you might want to include that too. So for the education section, you do want to make sure that it's your college education. So you don't want to include like elementary, middle school, or high school. You want to keep it at the college level. So definitely a pharmacy school and your PharmD degree you want to include. But also if you, for example, did 4 years of undergrad and you graduated with a bachelor's degree, you can also put that there, the college you went to, the bachelor you received in your major. So going into our professional experience section, so this is your work experience. So it's important to highlight that in the CV because it shows that you have experience throughout pharmacy school outside of the classroom. So you want to include name of the institution you worked at, whether it was a hospital or a community pharmacy, the address of this institution, so the city and state, and your job titles, for example, pharmacy intern. You want to also include your supervisor or preceptor and their title, as well as your start and end date for that particular job experience. Afterwards, at the bottom, you do also want to include some description of your role or your duty during that job experience in a bulleted fashion. But you don't want to go overboard with the number of bullets as well. Maybe you want to keep it to 3 to 4 bullets maximum, explaining your the different roles you played in that job experience. So experiential education, on the other hand, refers more so to your APPEs and IPPEs. With experiential education, in terms of formatting, it's kind of similar to the professional experience. So you're putting the name of the institution that you did your rotation at, city and state, name of your preceptor and their credentials, the start and end date of that particular rotation, as well as some description of the role and duties that you performed while on this rotation. But you do also want to put the rotation title. So you want to indicate if this rotation was an ambulatory care rotation, for example, an acute care rotation, community rotation. So you want to indicate with every experiential education that you put down what type of rotation it was. Next, we have our presentations. So I know during pharmacy school, you probably have given a lot of presentations. For the CV though, presentations are more of the high grade presentations you may have given. And a lot of it usually comes out from your APPEs and IPPEs. So it can include things like clinical pearls, in-service presentations you may have given to medical residents, for example, on rotation, or patient case presentations you presented to your preceptor. So all of these professional presentations, you can choose to put them on your CV. So when formatting the presentation section, you want to, of course, include the presentation title, as well as the audience or who you gave this presentation to, whether it was pharmacy residents, medical residents, preceptors, pharmacy students, etc., as well as location. So this will be like the site's name, city, and state, and the date of the presentation. And you can see an example of it here on the right. You could have the title of the presentation, who this was given to, there's pharmacy students, preceptors, and the site. The next two slides, the publications and posters, align with research. So it's important and good to have, if you have any publications, any posters that you presented, it's good to include them in your CV because it shows research abilities and it shows writing abilities. So it's always looked at favorably if you have any publications, any posters that you have created and presented. In terms of publications, this includes things like journal articles, newsletters, book chapters, even things like medical blogs, etc. You can choose to put them in your CV. But you want to make sure that you're just referencing it appropriately and it corresponds to what you're referencing, whether it's a journal article or a newsletter, that you're using the appropriate format and you're including the last name and first initial of all the authors that contributed with you to that publication. Sometimes people might choose to, if there's multiple authors, they may choose to bold their name as well to make it stand out when there's a couple of authors involved. So it's an idea to keep in mind. Next is the poster section. So I know as pharmacy students, probably a lot of you have been involved with research and have worked with a preceptor or professor to put together a poster. And maybe some of you are going to be going to mid-year in December and are planning on presenting there for ASHP. So if you have any posters that you worked on and you presented, you want to include that in your CV as well. And the way you would cite a poster is you want to include the last name and first initial of all the contributing members that worked on this project and this poster, the name of that research project, as well as the location of the poster presentation. So for example, at a conference, you want to put the conference name, the city and state that the conference took place in, and the date of that poster presentation. Next, we're going to shift gears a bit away from education, work, and research, and we're going to go into professional associations. So this refers to professional associations or like your pharmacy organizations that you may have been a part of during pharmacy school. So it's important that you put that on your CV because it helps to show dedication to the profession outside of the classroom setting. And it's great that you're involved in these organizations and you want to make sure that you include that in your CV. If you had any leadership roles, for example, say not only were you a member of APHA, but you were president of APHA during one of the years in pharmacy school, you want to include the organization name, the position that you held. If you were, for example, in an e-board for a certain organization, and you were involved with putting together events, you want to put that organization's name, the position that you held, as well as the date that you held that position. And you want to include description of some of the roles and duties that you had. If you were involved with any community service events as well, that's something, you know, employers would love to see. You want to include the event's name, the affiliated organization that helped to put this community service event together, as well as the date and the role that you played or how you participated in that event. Honors and awards. So for that, you want to include any recognition that you may have received for outstanding performance, whether this was education related or work related. So it would be nice to highlight this. You want to include the title of the award, for example, ROCI certificate, the organization that conferred this award, as well as the date that you got this award. Skills, this is something that people usually include in their CVs, special skills or talents, but you want to make sure that the skills that you're putting down on your CV are in a way relevant to your profession as a pharmacist. So you don't want to put down something like ability to juggle. That's not really related to pharmacy school, but maybe you're fluent and literate in a second language. You can put that down under your skills section of the CV. Especially as a pharmacist, you know, you're dealing with patients from different cultures all around the world. It's nice to know sometimes that a certain person is bilingual and can speak a second language. That would be something you can highlight on your CV. So common examples that are seen on CVs are language as well as technology. So for example, if you're knowledgeable about certain software systems such as Epic or Allscripts or PrimeRx in the community pharmacy, you can put that down in your CV. Lastly, references is usually the last section that you may find on a CV. For this section, you can simply just put available upon request for this. You don't have to include a specific person's name and contact information, but you can include it there at the bottom of your CV, kind of as like in a way that if references were asked from you, they're available. But you always, of course, want to ask for permission first, just to make sure that people you're gonna ask for reference are aware that you're putting them down. So some tips for formatting your CV. You wanna, for all of the different sections you have on there, when you're putting down the information, you wanna make sure that you're listing that information in reverse chronological order. So for example, if you held a job at CVS Pharmacy in 2021, and then you switched and you became a pharmacy intern at Hackensack Medical Center, for example, you put down that most recent job. So pharmacy intern at Hackensack Medical Center, 2022 to 2023. And then after it, at the bottom, underneath it, you would put pharmacy intern at CVS, 2021. So reverse chronological order when you're putting down your information in the different sections. You want to use past tense when you're writing down descriptions of your duties and responsibilities, for example, and during a certain job or in rotation. You want to make sure you're using past tense voice and in third person. You also want to make sure in terms of the appearance of your CV that it's consistent formatting and font throughout. So if you're using Times New Roman for the education system, that it's the same font throughout your entire CV, and you're maintaining the same font size throughout. And usually the font sizes are about 10 to 14. The standard is usually like font size of 12. You want to make sure you're using consistent header throughout your CV, as well as you're maintaining a CV margin size of 0.5 to 1 inch. Most important tip of all those is that you want to make sure you're being honest on your CV. So everything you're putting down on the CV is fair game when you go on interviews and you interview with potential employers. You want to make sure that you're being honest, because you may be asked about different information you put down in your CV, and nothing is worse than if they find out you're lying about something, or that you worked somewhere or you did something that you didn't really do. You want to make sure that everything you're putting in your CV you can back up and explain about.
Hi, do you mind if I jump in real quick?
Yes, of course.
I don't know if you have it on the next slide, so you can advance if you want to, and I'll just look through that real quick because I thought of something as you were talking. Because it kind of goes with this, but it's not, I don't think it's on here either. But make sure, like, one thing that I learned is, especially if you're including like descriptions of things or if something takes up a few lines, make sure it's all on the same page.
Mm.
So like you don't want to keep a description of something that you did, like the title is on the bottom of page 2, but the description is on the top of page 3. Like if you have to add some extra spaces to keep everything all on one page so that they can easily read it together, that's preferred. And the other thing that I'll do is if you have a section, like you may not have it yet, but as you keep building your CV, like let's say you just end up in an awkward space, you've done 4 presentations, but the presentation section starts at the bottom of a page. You'll have your header presentations, your first presentation, your second presentation. When the rest of your presentations are on the next page, I'll do another header that says presentations continued, just so that the person, like if they happen to open to that page and they look at the top, they automatically know that I'm still talking about my presentations without having to like flip back and forth.
Yeah, that's a good point too.
And I'll also really quick take on to Aya's point or Dr. Gamal Alden's point about as long as it's on your CV, make sure you can comment on it. Even if you were like a passive member in an organization, make sure you can at least tell interviewers something about serving on that chapter or whatever, what have you. Make sure that you can comment on something that you did for that organization and not that you were just attending meetings, essentially, that you did participate in some sort of activity in that regard.
Mm-hmm. Okay, so these were some CV tips. This slide is more so CV turnout, so things you don't want to do on your CV. So generally with CV, you want to avoid abbreviations. You want to spell out everything. So for example, you went to Fairleigh Dickinson University. You don't want to write FDU. You want to spell out the full name of the institution or the college. Avoid the use of graphics in your CV. You want to also avoid including events that occurred prior to entering pharmacy school, with the exception maybe of, like, for example, as we discussed, a degree. If you went to undergrad somewhere and you got your bachelor's degree, you can include that under education. But generally with the CV, as a pharmacist, you want to keep it relevant to pharmacy, your pharmacy career, and avoid things that happened before pharmacy school. You want to avoid any difficult to read fonts. You want to keep it to utilize your standard fonts, whether it's Calibri or Times New Roman. You want to avoid these fonts that can sometimes be difficult to read. Typographical errors, very important that you proofread your CV multiple times and you have your CV reviewed by others, multiple others if possible, because sometimes there may be spelling or grammatical mistakes on there that you don't catch and someone else may help catch it. So you want to proofread your CV multiple times and have others look at it as well to give you their feedback. And then finally, long descriptions when describing your rotational responsibilities. Again, as discussed, you want to limit the number of bullets you have for every experience on there, maybe to 3 to 4 bullets maximum. You don't want to overdo it with the number of bullets. So, does anyone have any questions? This brings us to the end of the presentation.
And I'll quick add on about the spelling thing. For a lot of people's headers, they'll put it in all capital letters, and Microsoft Word doesn't actually like proofread like a word in all capital letters. So that's just something to be cognizant of, is that spell check may not be working if your word is in all capital letters.
Interesting. Yeah, thank you about that.
Yeah, you could always use small caps if you wanted to do that and you wanted to spell check. And I think to Dr. Gamal Alden's point about the bullets, another thing to keep in mind is try to pick the most unique things and the most special things that you did on that rotation that would maybe set you apart from somebody else. Like, we all know that if you're on, like, I do acute care, we all know that if you're on an acute care rotation that you rounded on patients. But, maybe there's another like super unique experience that you got to do. Like maybe you got to like do some, maybe that was the only rotation where you got to do like med recs. Maybe that was the only rotation where you got to do like some nursing education or something like that. Like try to pull out the really special things that are going to set you apart from other people that were kind of like different experiences that you had versus the things that everybody's going to do on that same type of rotation.
Mm.
All
Does
right.
anyone
Does
have
anybody
any?
does anybody have any questions really quick? This is the prime time for everybody before we go into the next part of tonight's session.
I have a question. Hi, my name is Mansi. I'm a P3 student. I have seen this from like different views from people about writing the degree in front of the name. Do you think it's okay to write like what kind of degree you received, like maybe a master's or a PharmD, like just after your name on the CV?
Sorry, what do you mean after your name? So let me go back,
Like
for example, to
yeah, the first slide, if you go to where you put your name in the contact information, usually like where you say first A last name, and then I've seen people put their degree like PharmD after like Mansi Gandhi, then like comma and PharmD right there. I've seen people see like that kind of CV. Is it professional, or is it okay to do that, or it's not, it's something unusual, you don't see that?
I personally, I don't think I have my title right after my name on my CV, just because I also have like in the education section PharmD, so it's known that I'm like a PharmD. But I don't know if Dr. Campbell or Dr. Niels, if you guys have any.
I think I have mine up there. I think I have, because I have PharmD and I have BCPS, like I'm a board certified pharmacotherapy specialist as well. So I think I do put it up there. I'm sure either is okay. I think maybe the one benefit of putting it up there is just that as soon as somebody sees your CV, they automatically know. I would say like once you're applying for jobs, and we're assuming that like you've graduated if you're applying for these jobs, so it's probably not as relevant as maybe like a special certification, or like if you're getting your master's in public health or your MBA, like, but you wouldn't want to list MBA without the PharmD. So like if you're going to list them all, but I think you could also probably get away without it because they will be able to see it on your CV. But I think in order to highlight, especially if you have something, again, that sets you apart, board certification, an MPH, an MBA, some other sort of certification, it could be beneficial because sometimes those take digging to find in your CV. So if you have it right after your name, then everyone knows as soon as they look at it, like, oh, they have a master's in business administration. Like, that's great. So that's my take on it.
All right. Yep. Thank you so much. Appreciate that.
Okay. We have a student who raised their hand. Maria, would you like to share?
Yeah, so I just like about the email, like as a student, is it okay to use your student email? Like at what point should I go and make like a more professional separate email? Like at what point should I give up the student email?
I would say maybe as a pharmacy student, if your school email is your main go-to, the one that you check the most, and you're applying, for example, for residency, PGY1, then maybe you can include that in there. But once you've graduated, you're no longer a part of FDU, I would put your own like personal email at that point, or for example, the email if you're a resident, your email from residency, or if you're working, your work email. But if you're a pharmacy student, if you're still in pharmacy school, then you can just put your pharmacy school email on your CV. And then once you graduate, you change that email.
Okay, cool. Thank you.
Dr. Campbell or Dr. Niels, I don't know if you have any.
I agree with that. I would say like once you're not a student anymore, probably don't want to include an email student or email address that has the word student in it. Just kind of that may confuse people.
Yeah, I think it depends. So, I graduated a little bit, not too much longer, but a little bit longer ago. And my email address as a student actually didn't have student in it. It was just at wilkes.edu. And actually a lot of us at least the ones that I graduated with, actually kept that email because the school allowed us to keep that email. So we used it, but again, it didn't have the name student in it. It was more once I was in a professional career and like kind of looking to maybe change jobs and things like that, that you don't want them going to your professional email. And I was like, okay, like maybe I'm at the point that I should drop this. So I think they do make a good argument though that the FDU emails are at student.fdu.edu. So it may be a good idea to, upon graduation, maybe either change the name of your personal email depending on what it is to make sure it's professional, or like create yourself a new personal email that you can use for those things.
Wonderful. Are there any other active questions? If not, what I wanted to do is I wanted to go over the kind of the next portion of what we want to do tonight. There are some participants that did join after we did start. We did want you all to name yourselves with the P3 or P4 after your name, so the clinical faculty that we have here tonight can identify like who they're talking to and the specific needs that you have. So what we're going to do is we're about to break into breakout rooms. And what we're going to do is have each of our clinical faculty be joining a room. This is what I propose to you all. If you do not currently want, small group resume counseling, you do not need to be here tonight. However, like for the rest of tonight's session. However, if you're interested in being in a small group of a breakout room, I will say, please stick around. We want you all to either share your CV if you're comfortable, private message your clinical faculty with a file to your CV for them to kind of share. And what I will say, one of the benefits of this is your CV sharing experience, even if you're just sitting in and listening and watching, you might have questions, comments, or just a reaction to what is being said that might be helpful for your individual CV experience. So what I'm about to do, again, that's my offer to you all. I only want the people that are kind of continuously serious about this session tonight. So